I woke up, I could not move my arm or my leg at all. I was telling my brain to get up, get out of bed. I couldn't. So I dragged myself to the edge of the bed, and I stood up, and I went falling down. And that's when I realized something is wrong.
It was the middle of the night, December 3rd, 2021. Darren Sutton woke up, but his brain and body seemed disconnected. He was not in pain, but he could not make his body work. He had suffered a stroke.
So I made 2 phone calls, one to my friend and one to the 911. Let's get you downtown. Where you want to go to? And I told them MUSC.
8 weeks later, Sutton is back at the Medical University of South Carolina. And for the first time since suffering a stroke, meeting with Dr. Sami El-Kassab, who removed the blockage from his brain. Dr. El-Kassab showed us Sutton's surgery.
And so in this particular case, we were able to go in, and the clot was sitting in this middle cerebral artery.
He explained that about 85% of strokes are ischemic, meaning the stroke is caused by a blood clot that blocks blood flow to an area of the brain. Starved for blood and oxygen, brain cells begin dying.
And then after we took it out, there's restoration of blood flow. His symptoms did improve, and he went home the next day.
Dr. Christine Homestead says saving a person's brain takes a lot of resources.
It's not as simple as, for some other disease where you can just do a single test and you can say, yep, that's definitely what it is, let's treat it. We have to do a neuro exam real quick. We have to get a scan of the patient. We have to get labs for the patient. We have to get a full history to make sure that we can give them that clot-busting medicine without hurting them. And that's a lot. That takes a lot of team members.
She leads a team of neurosurgeons and neurologists working to build a brain attack cave, a centralized facility where stroke patients get treatment.
What our goal is to make it a smooth process where the patient comes in and the team descends on the patient, and the patient doesn't have to move.
She says South Carolina is in a region of the country known as the Stroke Belt, an area where people are disproportionately affected by stroke.
We are in the Stroke Belt, and that's the southeast. There's about 7 states, North Carolina, South Carolina, Mississippi, and others, where the rates of stroke are much higher than the rest of the country.
Right now, the Brain Attack Cave is just an idea that this ambitious team believes could be a game changer for people who suffer strokes.
This concept has not been attempted or done anywhere else. And we're fortunate at MUSC with the opening of the Children's Hospital that we have vacancy. Of course, hospitals, the room is what there's never enough of. That allows us a unique opportunity where we have room, where the pediatric ER used to be right next to adult ED. That's now space that's up for grabs. Wherever we can shave time, that will help save lives and help brains. So we're just ultra focused on getting that patient the treatment as fast as possible, and that's what we're here to do.
Sutton says he hopes MUSC is able to build a Batcave that will give care to patients with no delays, because time is of the essence in brain matters.
They should have it in just one area, and you don't have to go bouncing from one location to another location, definitely. And it would make a great difference as well. I mean, I'm a witness of that.